Okay, let's dive in. When you think about pediatric surgery, I mean, the complexity alone is staggering.
Absolutely. The precision needed and, frankly, the sheer emotional weight of it all.
Exactly. We're talking about the most vulnerable patients here. Tiny babies, kids
Yeah.
facing really critical conditions sometime.
It's a field where, just knowing the textbook stuff, it's simply not enough.
Not even close. You have to be able to connect that theoretical knowledge to what's actually happening in the clinic, in the OR, often under incredible pressure.
Right. And the big question then becomes, how do you effectively build that bridge,
Yeah.
especially for doctors and surgeons at different points in their careers?
Yeah, how do you make complex information not just accurate, but like really accessible and reliable?
And immediately useful, whether you're a medical student trying to get your head around the basics or an experienced surgeon needing a quick confirmation.
Mm-hmm. Which brings us neatly to our source material for today. We have some information about a specific resource that, well, according to the description we've got, aims to do exactly that.
Yeah, it's a book called 100 Questions and Answers in Pediatric Surgery. It's by Dr. Atef Ahmed.
Okay. So, our mission today for this deep dive is really to unpack what the source material tells us about this book.
Exactly. What is it? Who's it for? And why does the source call it an indispensable guide? We're sticking just to the details provided about this specific resource.
Right. No outside opinions, no reviews, just what does the description itself say? What are the key nuggets of information in the source material we have?
Let's get into it then. So the source clearly identifies the book, 100 Questions and Answers in Pediatric Surgery.
And the author, Dr. Atef Ahmed.
Yes, and the source makes a point of highlighting his credentials. He's described as a renowned medical educator and also a distinguished expert in medical education.
Oh, interesting. So not just a surgeon, but someone specifically known for teaching medicine.
That's right. Which, might suggest something about the book's approach.
Yeah, you'd think so. How does the source describe the book's main goal, its purpose?
Well, tying into that background, perhaps, the source says its core purpose is precisely to bridge the gap between theoretical knowledge and clinical application.
Okay, that phrase again, bridging the gap.
Mm-hmm. It aims to be, and this is a direct quote, an essential tool for the people it's intended for.
An essential tool. Given the stakes in pediatric surgery, like you said, that bridge isn't just nice to have, it's, well, essential.
Pretty critical, yeah.
So how does it actually do that? According to the source, what's the format like?
It uses a clear and systematic Q&A format, questions and answers.
Right, like flashcards almost, but in book form.
Sort of, but it seems more in-depth. The source emphasizes in-depth coverage across a comprehensive range of
Yes,
topics.
comprehensive, like.
Like everything from neonatal care to adolescent surgical issues. It's a pretty wide spectrum.
Wow, okay, so from the tiniest patients right up to teenagers, that is broad.
And when you glance at the associated keywords listed in the source, things like specific techniques, disorders, diagnostics, complications, recovery, you really get a feel for just how vast pediatric surgery is, and presumably what the book tries to cover.
That Q&A format is interesting, though. It suggests a more active way of learning, doesn't it? You're not just passively reading.
Exactly. You're kind of forced to engage, to test yourself. The source mentions it's crafted to test but also enhance understanding.
Which seems crucial in surgery. Recall, application under pressure.
Right. It also mentions fostering critical thinking and decision-making skills, things absolutely vital in this field.
Okay, so Q&A, broad coverage, focus on application. Who exactly is this book for, then? Does the source specify?
Oh yeah, very clearly. It explicitly lists the target audience.
Lay it out for us. Who are they aiming at?
It mentions medical students, residents, and practicing surgeons in the field of pediatric surgery. So the whole pipeline, really.
Students, trainees, and experienced docs. That's quite a range. How does the source say it helps each group? Does it break that down?
It does. For medical students, the idea is to help them gain a solid foundation.
Makes sense. Building blocks.
Right. And enhancing your understanding and confidence, specifically as they prepare for your surgical rotation. That first real clinical exposure.
Okay, helping them feel a bit more ready for that leap. What about residents? They're further along.
For surgical residents, the focus shifts. It's about helping them hone your skills and knowledge.
Sharpening the tools they already have.
Exactly. And, crucially, ensuring they're well prepared for board exams and clinical challenges. Big hurdles, those exams. And the daily clinical reality.
Mm-hmm. So moving from foundation to refinement and exam prep, and then for the surgeons already out there, practicing.
For them, the source describes it as a tool to keep your expertise sharp.
Continuing education, basically.
Yeah, serving as a handy reference for refreshing your knowledge. And importantly, staying updated on the latest surgical approaches and guidelines,
That's huge. Things change so fast in medicine.
especially in surgical fields. New techniques, updated guidelines. You have to stay current.
So the source really paints it as a resource that kind of evolves with you through your career path in pediatric surgery.
That seems to be the message, yes.
Which leads to the obvious question. Why this book? According to the source, what makes it stand out? What are the key selling points, the features and benefits described?
The source lists quite a few. First off, expert insight. It connects this back to the author, Dr. Ahmed, highlighting his extensive clinical experience and deep understanding of the field.
So it's grounded in real-world practice, not just academic theory.
That's the implication, and it ties into his expertise as an educator, too, someone who knows the field and how to teach it.
Okay, what else?
Practical knowledge. This links back to the Q&A format. The source says the questions are designed not just to test recall, but to enhance understanding and foster those critical thinking and decision-making skills we talked about.
Right, making you think like a surgeon. Apply the knowledge.
Exactly. Then there's updated and relevant. It stresses that the book helps you stay current with the latest advancements and techniques.
Keeping pace. Essential. You mentioned exams before, too.
Yes, exam preparation is explicitly listed as a major benefit. The source calls it an invaluable resource for board and certification exam preparation
How so?
by offering a thorough review and self-assessment opportunity. That Q&A structure is naturally suited for prepping for those kinds of high-stakes tests residents face.
Makes sense. Is it just for studying and exams, or?
No, the source also positions it as a clinical reference, a quick reference for everyday clinical decisions in pediatric surgical care.
Ah, so you might grab it on the ward? Or before a case?
That's the idea presented. For those moments you need a quick check on something specific, adds that layer of immediate practical utility.
Okay. Practical, updated, good for exams, useful in the clinic. Anything else?
It's described as both comprehensive and concise, covering that wide array of topics, but doing so in an accessible, easy-to-understand manner.
So thorough, but not overwhelming.
That seems to be the goal. And, crucially, it emphasizes evidence-based answers. Each answer is apparently backed by the latest research and guidelines.
That's non-negotiable in medicine, isn't it? Reliability and accuracy based on evidence.
Absolutely fundamental. So the source really pushes its versatile use. Good for studying, good for exam prep, good for quick clinical lookups.
It's trying to be many things to many people within that specialty.
It seems so. The source even wraps it up by calling it more than just a book, describing it as a companion for your medical journey, guiding you towards excellence in pediatric surgical care.
A companion. That's quite a statement for a textbook.
It is,
Yeah.
but based purely on the description provided in our source material, that's the picture painted. A Q&A guide from an expert educator covering a vast field designed to be practical, current, evidence-based, and useful across the training and practice spectrum in pediatric surgery.
Right. Helping bridge that gap we started with between knowing the stuff and actually doing it effectively. You know, thinking about that whole journey from nervously starting your surgical rotation through the intensity of residency and exams to making those critical calls as a practicing surgeon, it really highlights how vital good resources are.
Resources that don't just dump information on you, but actively help you learn, retain, and apply it.
So let's leave you, our listener, with a thought based on this description. Considering how the source presents this book, particularly that Q&A format, the focus on being concise yet comprehensive.
How might resources structured like this potentially change how complex, high-stakes medical knowledge is learned and used in the real world, maybe compared to traditional textbooks or lectures?
Yeah, what does the appeal of a format like 100 questions and answers tell us about what makes learning effective, especially when the pressure's on in fields as demanding as pediatric surgery? Something to think about.